Hi everyone, my name is Portia and today I will be talking about a disorder called bipolar disorder. Bipolar disorder is a chronic mood disorder that involves alternating episodes of mania, hypomania, and depression. It's classified into bipolar I, bipolar II, and cyclothymic disorder. And this classification is based on what is involved, like is either mania or depression or the cyclothymic mixture of both mania and depression. This disorder, bipolar, it affects daily functioning, it affects relationships, and it also affects decision making. So I will describe the various types of bipolar disorder. So we'll start with bipolar 1, and this classification is based on DSM-5. It's a diagnostic tool that is used to classify mental health disorders. So for a person to be classified as having bipolar 1, he should have at least one manic episode, and they might have a depressive episode or a hypomanic episode. And the mania that person experiences should last for at least 1 week. And the symptoms during this time, they have inflated self-esteem, like they think too high of themselves. They have decreased sleep. They also experience rapid speech, and they get involved in risky behaviors like going to unsafe places, doing things that are not safe, involving in practices that are not safe, like maybe walking on the road or getting into dangerous things. And for bipolar 2, it involves having one hypomanic episode and one major depressive episode, but there's no full mania. Full mania is like that point of full confusion, of full like at the point where they are like super confused and aggressive and all of that, but they don't have that. So for bipolar 2, they have hypomania, where they have like that agitation, but then it's not like full blown. And then they might also experience, they should also experience one major depressive episode. And risk factors and cultural considerations for bipolar 2 involves like family history, brain chemistry. When a person has imbalance in serotonin, dopamine, and norepinephrine, it can lead to them developing bipolar disorder. Also, if they experience like serious stress or trauma in life, with the history of mental health problems or family history of mental health problems, that trauma or that stressful event can trigger them to develop this disorder. Also, cultural differences in expressing emotions can also cause a misdiagnosis. That's where we have a problem, because in some cultures people are very quiet and they are like less expressive, but in some other cultures people are very, very expressive, and they might feel like, oh, maybe you're sick. So that is where cultural differences can cause a misdiagnosis, but most of the times that is not the case. And what do we mean when we say a person is experiencing mania? Mania means that you have an elevated, or you have an irritable mode. You have very high energy and you don't sleep. You're also experiencing grandiosity. Grandiosity means that you're saying that you are the most important person in the universe. You can be saying that you're God or you're Jesus Christ, or you might be saying, oh, I'm the president, or I'm the friend to the president, or I just spoke with the president yesterday. When you see people that say things like that, is an expression of grandiosity. Impulsivity means that they do things without even thinking. Like the moment it comes to their mind, they just do it without thinking, and sometimes it could be like dangerous things, but they just do it anyway. That is for a person that is experiencing mania. And depression means that that person is experiencing sadness, hopelessness, fatigue, that's tiredness. they're not able to concentrate, and they're also having suicidal thoughts. They feel like life is worthless, life is not important, and they feel like they should just end it all. Hypomania, it's a milder form, as I said earlier, of mania without major functional disruption. It means that they are irritable, they have that high energy, but then it's not like at the very, very high level. It's still at the level where they are a bit in control. And then the rapid cycling or cyclothymic means that it's a mixture of mania and depression. A mixture of like being irritable and then being the super tired, being the super sleepy, and then just like that. And then for a complete cycling episode, you should have 4 mood episodes a year, and it should be severe. 4 severe mood episodes in a year. And what is the pharmacological management? Pharmacology means the medications. How do we treat them medically? The first line medication for the treatment of bipolar disorder is called lithium. Lithium is a medication in the class of medications called mood stabilizer. Some other medications that are also used for the treatment of bipolar is valproate, carbamazepine, lamotrigine. All of these medications are used based on the type. If the person is experiencing mania, then they use the mood stabilizer to help calm down the irritability. If the person is experiencing depression, then they use also a mood stabilizer, but then they would not use a medication that will help calm them down, but they'll use a medication that will help them be more active. Olanzapine and the other antipsychotic medications are used during manic episodes, when they are irritable, when they are having the grandiosity, when they are being very, very impulsive. Yes, that is when we use olanzapine. And then side effects of these medications that they use to treat bipolar disorder: for lithium, they experience tremors, they might have problems with their thyroid hormones, they might also have problems with the renal, like the kidneys. And for valproate, that will experience, there's like a risk for complications with their liver, they might also experience weight gain. And for carbamazepine, they might experience dizziness and low sodium. For lamotrigine, the risk for lamotrigine is skin rash. And the olanzapine, they might experience metabolic syndrome. Metabolic syndrome is a complication that affects your respiratory system. It could be based on the way that carbon dioxide and oxygen and bicarb is distributed in your body. There's like a number where it should be within that range, but then if your bicarbonate is higher than it should be, then that time you start to have metabolic, depending on if your acid is high, it will be metabolic acidosis, or if the metabolic acidosis, or you might experience metabolic alkalosis. But olanzapine affects your metabolism. Your metabolism is mostly in your abdomen. And for patient teaching, for medications for bipolar disorder, and there's emphasis on them adhering to medication regimen the way the doctor has prescribed. There's also emphasis to notice early side effects of the medications. There's emphasis to monitor blood levels, especially for medication like lithium. The level for lithium is 0.6 to 1.2. That's the most therapeutic level, especially if it's a routine medication that they've been on. So if their current level for lithium is more than 1.2, there's increased risk for toxicity. And if it's less than 0.6, it means that it's not even within the therapeutic range, so it will not be effective. So lithium is a medication that the blood level is monitored, because there's high risk for toxicity, and toxicity can be very, very dangerous to the patient. And patients are also educated to avoid alcohol, because alcohol interacts with a lot of medications. It interferes with the way the medication works. So encourage patients not to consume alcohol while on this antipsychotic, any of these medications for bipolar disorder or any mental health condition. And patients with bipolar disorder, they are being taken care of by psychiatrists, nurses, social workers, because they make treatment plans for them, education, and then they plan like follow-up visits for them. Yeah, and then for non-pharmacological, that means treatments that do not involve medications. We have nursing diagnosis for risks for injury. So we want to make sure that these patients are in an environment where they cannot really hurt themselves. We have all dangerous things moved away from the environment. Also, they might experience disturbed thought process. So we want to make sure that we don't expose them to things that will cause them to become irritated and overreact, or things that will trigger that reaction, and then it might become aggressive, and then it might lead to them harming themselves or harming somebody. And then they might also experience ineffective coping. So the way we talk to them should be in a calm and approachable manner. And yeah, we also try to make sure that they do not experience really stressful conditions, because that might trigger them and make their conditions really get worse. So some of the goals that we can set for this patient is that, for example, we can say that the patient will remain injury-free during hospitalization over the next 5 days. And what are the interventions that we'll use to help this patient maintain this or reach this goal? We monitor their mood and their behavior. We'll provide a calm environment for them. We'll set firm boundaries, because if you just tell them like in a playful way, oh, you're not supposed to do this, they might think that, okay, you're just joking, and then they still go ahead and do it. But when we set firm boundaries and we stand for what we tell them, it will help them know that we are very serious about what we're doing, and then on what we expect from them. That would be like setting expectations. We also want to encourage hydration, nutrition, and rest, especially when a patient is in a manic episode. They have difficulties sitting down, staying calm, and eating. So we want to give them highly nutritious drinks like protein shakes, and then high calorie finger foods. That will help them to have enough nutrients, because when they are in a manic episode, they are walking up and down, up and down, up and down. And primary concerns and interventions, risks of harm. We want to ensure constant supervision, especially during manic episode, and even during depressive episode, because there are risks for suicide. We want to ensure constant supervision. We see what they are doing, we know what they're doing, and we are aware of all the things around them. And also, because they might have impaired judgment, we want to offer structure and redirect them in like, okay, now we are going to do this activity, now we are going for this therapy, like tell them what steps, like the steps on how it will be done, and direct them on how to do it, because they have impaired judgment. They cannot properly understand, especially if you give a direction in like a very long step. So you give like short brief steps, and then you direct them as you get along with the activity. And above all, we should use therapeutic communication to build insight. We should use the kind of words that would help soothe the patient. We should use the choice of words that will not irritate the patient, because that is very, very important. It will help the patient to trust us, to build a therapeutic relationship with us, and then they'll believe the instructions and the directions we'll give them, and that will help in their healing. And all of the information that I've discussed are referenced from the DSM-5, as I mentioned from the beginning, and also from NANDA International. Bipolar disorder is a serious but manageable condition with proper diagnosis, medication support, and nursing care. Thank you for watching.